Hoarding disorder, signs, symptoms, and treatment. Hi, I'm Michelle Risser, and I'm a licensed therapist, and let's talk about hoarding disorder. In this video, we'll go over what is hoarding disorder, different types of hoarding disorder, symptoms of hoarding, and how to get help for hoarding disorder. First, what is hoarding disorder? Hoarding is known as collecting or accumulating large amounts of something, such as money or food. When used in an everyday manner, the term hoarding does not indicate a psychological problem. The psychological definition of hoarding involves consistent difficulty with getting rid of possessions due to a perceived need to hang on to them. The two definitions for hoarding are differentiated by severity and by one's thoughts and feelings related to their belongings. There are a few specific categories that some people with hoarding disorder often gravitate towards, including animals, paper, and food. Let's go over hoarding animals. Animal hoarding is a specific subtype of hoarding that is prevalent in people with hoarding disorder. An animal hoarder's living space will look about the same as a general hoarder, with the addition of having an abnormal number of pets or animals, usually cats. Next up is paper hoarding. Another common problem for people with hoarding disorder is the hoarding of papers. This occurs mostly in the form of magazines, catalogs, newspapers, and books, but it could be any paper product. And the last subtype is food hoarding. Food hoarding is often associated with eating disorders. When an eating disorder is ruled out as the cause, it can be observed that food hoarding has all of the same elements as general hoarding. Food hoarders collect multiples of food items, perhaps due to sales. The food is disorganized and there's little to no space remaining to use counters, stoves, and other surfaces. The individual is emotionally tied to the food. This could be based on childhood deprivation due to neglect, poverty, or having lived through a war or an economic depression. Symptoms of hoarding disorder include acquiring too many belongings, an incapacity to organize the items in a neat, logical manner, assigning emotional importance and value to possessions, experiencing intense emotional pain and difficulty relating to letting go of these belongings. The behaviors seriously interfere with the quality of the person's life. This could include relationships, physical safety, and secure housing. Despite the threat to the quality of their life, the individual feels unable to change these behaviors. How to get help for hoarding disorder. Although hoarding disorder affects an estimated 1.2 million people in the United States, finding a hoarding-specific therapist is not always easy or straightforward. Since the disorder is thought to be related to OCD, and the majority of those diagnosed with hoarding disorder also have other disorders, such as generalized anxiety or major depression, it's helpful to search for a mental health professional who has a specialty in working with these problems.